Hello, welcome to 5 News. I'm Polly Whitehouse. It's one of the most popular procedures of a booming industry. Now, Britain's top doctor has warned that cosmetic fillers are a crisis waiting to happen. In a long-awaited report, Sir Bruce Keogh said it was bizarre that almost anyone could give someone else an injection and not need formal training. He attacked the industry for trivialising the procedures. And following our investigation yesterday, he told 5 News it was reprehensible that fillers were available direct to customers online. Our health correspondent Catherine Jones has this report.
We've laid bare the marketing activities of Huveni, which sells dermal fillers online and advocates self-injection.
International doorstep delivery.
We heard evidence of the potentially damaging consequences.
She had a blood clot underneath her eye. She had difficulty closing her eye.
And drawn Huveni to the attention of the UK's medicines regulator.
The UK part of the website has been closed down.
But the internet is a global marketplace, so Huveni's products are still available on its American website. Today we showed what we reported last night to the medical director of the NHS.
Well, firstly, well done to Channel 5 News, because you've probably saved a lot of women a lot of suffering.
And Sir Bruce Keogh was forthright in his criticism of Huveni's activities.
I think it's absolutely reprehensible that this stuff is available without any checks or balances for people to inject into themselves.
It's the day Sir Bruce has published a scathing review of the regulation of the entire cosmetic industry, and his prime concern is fillers, which are a crisis waiting to happen, according to his report. He recommends reclassifying fillers as prescription only, which would restrict their use to practitioners working under a doctor or a specially qualified nurse, a stark contrast to the lax regulation now.
You know, they've got the same level of safety checking as a toothbrush or a ballpoint pen. And that can't be right.
However, those representing the beauty therapy industry fear restricting access to fillers might drive unscrupulous salons to operate illegally, using supplies bought online from the likes of Huveni.
I hope this doesn't push it underground. I hope that the public are aware that finding a correct, qualified practitioner and looking at the correct registers that hopefully will be put into place, they then will know they're in safe hands.
Since I made Huveni aware of our investigation, they appear to have ramped up their promotion efforts. Their Facebook page has new posts trumpeting the launch of a faster delivery service to the UK and an option to buy by mobile phone. If the government does legislate to tightly restrict who can administer fillers, it needs to be ready to clamp down on those prepared to flout that law and the firms likely to be keen to supply them. Catherine Jones, 5 News.
Though fillers were singled out for the worst criticism, Sir Bruce's report laid bare worrying practices right across the cosmetic industry, from Botox to breast implants, tummy tucks to nose jobs. He said patients were being left at risk, and he attacked companies for being more interested in profit than care.